Hello everybody, this is Dr. Kukreja Kalani and today I'll be talking about endocrine and metabolic disorders. So what are the common diseases related to endocrine and metabolic disorders and their causes, symptoms, risk factors, and what is the care which is needed while you suffer from the symptoms related to these organs or system. So, endocrine and metabolic disorders affect the body's hormone production and regulation, impacting various organs and metabolic processes. Below, so basically, what are their causes, the symptoms, risk factors, and what are the key aspects of care. So, first we talk about diabetes mellitus, a metabolic disorder characterized by high blood sugar levels due to insufficient insulin production or insulin resistance. Symptoms are basically excessive thirst, frequent urination, fatigue, blurred vision, slow healing, sores. Causes are genetics, obesity, physical inactivity, autoimmune destruction, type 1 diabetes, insulin resistance, type 2 diabetes. Now we talk about the hypothyroidism, an underactive thyroid gland that fails to produce sufficient thyroid hormones. Symptoms are basically fatigue, weight gain, cold intolerance, dry skin, and constipation. Causes are basically an autoimmune conditions like Hashimoto's thyroiditis, iodine deficiency, and certain medication or radiation therapy. Now we talk about hyperthyroidism, an overactive thyroid gland that produces excessive thyroid hormones. Symptoms are basically nervousness, weight loss, increased heart rate, heat intolerance, and tremors. So, what are the causes? Autoimmune disorders like Graves' disease, thyroid nodules, excessive iodine intake. Now we talk about the Cushing syndrome, a disorder caused by high levels of cortisol over time. Symptoms of weight gain, especially around the abdomen and face, purple stretch marks, high blood pressure, and thinning of the skin. Causes are prolonged use of corticosteroid medication, pituitary or adrenal gland tumors. We talk about polycystic ovary syndrome, PCOS, a hormonal disorder in women characterized by multiple cysts in the ovaries and hormonal imbalance. Symptoms are irregular menstrual periods, excess hair growth, acne, weight gain, fertility issues. What are the causes? Insulin resistance, hormonal imbalance, genetics. Addison's disease, a condition characterized by insufficient production of cortisol and aldosterone by the adrenal glands. Symptoms are fatigue, weight loss, muscle weakness, low blood pressure, and darkening of the skin. Now, what are the causes and risk factors of diseases related to the endocrine system? So it is first it's a genetic history, a family history, and many endocrine disorders such as diabetes, hypothyroidism, PCOS have a genetic link and are more likely to develop in individuals with a family history of these conditions. We now talk about autoimmune condition, immune system attacks disorder like type 1 diabetes, Hashimoto's thyroiditis, and Addison's disease occur when the immune system mistakenly attacks the endocrine glands. So about we talk about the lifestyle factors that is related to diet and physical activity. Poor diet, high sugar intake, and lack of exercise can lead to metabolic disorders like type 2 diabetes, and obesity increases the risk of endocrine imbalances. Stress and medication. Chronic stress, prolonged stress can lead to hormonal imbalances, particularly involving cortisol. Long term use of corticosteroids can also increase the risk of Cushing syndrome. We talk about the obesity, the weight related risk. Obesity is a significant risk factor for type 2 diabetes, PCOS, and insulin resistance. Now, what are the hormonal fluctuations which make you vulnerable to the endocrine disorders? So, changes during puberty, pregnancy, and menopause. Hormonal changes during these phases can trigger or aggravate endocrine disorders such as PCOS or thyroid dysfunction. Now, what are the warning signs or symptoms to look for? The metabolic disorders like the weight changes, sudden weight loss or gain can indicate thyroid imbalance or diabetes. Fatigue and weakness, it's a common symptom of hypothyroid, Addison's disease, and diabetes. Frequent urination and thirst, which is indicative of diabetes mellitus, particularly type 1 and type 2. Hormonal imbalances, irregular periods, Irregular menstrual cycles, missed periods, or heavy periods may indicate PCOS or thyroid issues. Physical changes, skin changes. Dry skin is common with hypothyroid, while darkening skin can be seen in Addison's disease. Hair and nail changes, hair thinning or loss of hair, brittle nails, hirsutism can point towards thyroid and adrenal imbalances. So, what is the care which needs to be taken for endocrine and metabolic health? Regular monitoring, blood sugar levels, routine monitoring for those with diabetes or pre-diabetes helps prevents complication. Hormone testing, regular thyroid function tests, cortisol levels, and other hormone assessments are very important for early detection and effective management. Having a balanced diet, low sugar and carbohydrates, and maintaining a diet low in refined sugars and carbohydrates helps manage diabetes and prevent insulin resistance. Physical activity. Regular exercise is a key to improving insulin sensitivity, managing weight, and reducing the risk of type 2 diabetes and metabolic syndrome. Stress management. Relaxation techniques, practices like yoga, meditation, and deep breathing helps reduce cortisol levels and balances the hormone production. Adequate sleep. Maintaining a consistent sleep schedule and ensuring restful sleep are crucial for hormonal regulation. Health, healthy lifestyle habits, weight management. Maintaining a healthy weight helps reduce the risk of insulin resistance, type 2 diabetes, and PCOS. Avoid smoking and excessive alcohol. Smoking and alcohol can disrupt endocrine function and increase the risk of diabetes, obesity, and adrenal disorders. Adequate fluid intake, that is hydration. Proper hydration supports metabolic processes and helps kidney remove excess glucose in individuals with diabetes. Routine regular checkups, regular screenings are very important for early detection of conditions like diabetes, thyroid dysfunction or adrenal issues helps prevent complication. Adhering to prescribed medication schedules and consulting healthcare providers for adjustment helps maintain hormonal balance. Proper care of endocrine and metabolic health involves a proactive approach that includes a balanced diet, regular exercise, stress management, routine screenings, and a healthy lifestyle choices. Early identification and consistent monitoring are key to managing these conditions effectively and maintaining overall well being. This is Dr. Kukreja Kalani signing off. Thank you.